SI joint. What is SI joint? So I explained you about the joint that is formed between the pelvis and the spine. Okay, so for let me put it in a very simple way, that when people are having weak musculature in the spine, over a period of time these muscles have weakened, and they are constantly giving you some kind of pains and some kind of communications which we don't actually listen to, right? So these muscles which are paining are actually undergoing a cycle of injury. So this is a cycle that keeps on happening, where a muscle gets injured, muscle is weak, then it loads, then it gets injured. After a certain time, when you do not treat it, it can go back to the injuries again. Okay, this cycle has to be broken. So when it happens in the lumbar spine, or the muscles around the pelvis, especially the pelvic floor muscles, which is another part of your core musculature, when these muscles are weak, they put a lot of load on these bones or on these joints. Okay, so there is a lot of stiffness in the lumbar spine. Your abdominals and your core musculature starts weakening. When these muscles start weakening, there's one thing you notice is the people will start going into hyperlordotic curvature. Get it? So this is my neutral spine, and people whose core musculature weakens, it starts weakening and your lumbar muscles start tightening. So when this happens, the SI joint jams. This is also seen in mainly women who wear high heels, yeah, because their pelvis is not neutral, it is in the anterior pelvic tilt. Okay, so when this happens, the SI joint jams and they start rubbing each other, right? So all those people who have SI joint issues, stop sitting cross-legged. Like, don't fold it, cross your legs and sit, because that is according to certain biomechanical positions, it is one of the worst ways of sitting for people having SI joint pains. Now, since you understood about the curvatures of the spine, when you sit in this position, do you think your spine is maintaining its normal curvature? Absolutely no, it is not. The very good idea of sitting is, when you sit, do not lean yourself back to the bed. You can sit down, or you just sit a little forward, keep a small round pillow, or you can also keep a ball behind your back, so that it doesn't fall back and your organs are not compressed there. Okay, lot of spine strengthening exercises. Good question there. Now, if you see Indian gyms or Indian fitness centers do not actually do the core exercises. They all concentrate on abs. How you get those six packs? My dear, it is not so difficult to get the six packs, because they are the most superficial muscles. Clean up on your diet, your six packs will be available there. Okay, but the best way to keep your spine strong is strengthen your core muscles. Now, there are a lot of exercises, you can find them, especially Pilates, which is very unfortunately and sad that Indians do not follow the Pilates way of exercises, because Pilates is a spine centric exercise and it keeps strengthening your core. Every exercise for that matter is core centric and spine centric exercises, which will be the best way of doing. I will also try to make some videos to explain and show you what are the basic exercises. The intensity varies right from beginners, intermediate, advanced levels. So I will start with the beginner video. Make sure before you get on to the gym, because I do not trust the Indian gyms. not most of them. So I would recommend you to first do spine strengthening. So spine muscles don't, any muscles for that matter, don't strengthen in a day or two. Definitely you need a long time. So if you have landed in a disc bulge, it will definitely heal within 14 days, but for the weight to be distributed among the muscles is supposed to be more stronger, right? So you might need a month or 2 or maybe 3 months of exercise. It says that 12 weeks are needed for spine or the spine musculature strengthening. So it is good if you just start with the basic spine strengthening exercises or beginner pilates and strengthen your muscles, and then go back, hit the gym. Make sure there are certain positions you're supposed to avoid, like directly bending down and lifting like 100 kg weights. No, please don't do that. Weights are not needed so much for a normal person who doesn't want to build his body to go into some kind of competition, bodybuilding competition or something. Keep your weights limited. I would say keep it to 10 kgs. That is more than enough. And unless you want to build your body really huge, also try to avoid lifting it straight up. Try to squat down. Use your arms to lift it straight up without bending your spine forward. Okay. Any kind of pain is a sign of muscle injury. Try to rest the muscle. Put some cold pack on it. Do not, once the muscle starts paining, do not think that it's okay and keep continuing your exercises. You are supposed to rest the muscle, because if you are working out 20%, 80% recovery is definitely important. So make sure you recover your muscle completely. Try to understand what was the reason for the muscle injury. See if you are doing your neck muscle exercises as well. Now I have also seen people, when I ask them, do you do neck muscle exercises, they say, yes, I just move my neck. This is not an exercise, my dear. There is a difference between movement and exercise. Here you're just moving your neck. Okay, there is a very better way of exercising your neck is you can just take a band. Okay, it's called as TheraBand or elastic band. Keep it mildest resistance. You're not supposed to take a very heavy resistance thinking muscles will build up more. No, please don't do that. Our muscles are very small in the neck. It's better we keep the lightest resistance. You can just tie it around your neck, hold it that way. Keep your neck in the neutral. Don't keep it in this position. Keep the neck in tucked in position, and you can just pull it forward like that. Get it? You can also do this exercise for side muscles, pulling it this way and also to the other side. Okay, 20 reps, 3 sets a day should help you. Always related to lifting heavy weights. It can be related to the weak muscles which are not ready to take your body weight even in your daily activities. Your daily activities can cause issues to the spine if the muscles are that weak. Do you understand that? So it's very important. Don't be in a myth that only lifting weights will give you slip disc. Traveling, bad travels, a lot of ditches on the roads, any kind of accidents, and also long hours of sitting can also give you a disc bulge. So make sure you are exercising. Definitely there is no age limit for a person to strengthen, because our muscles actually respond to us at any age. You might have seen, look into the YouTube, there are around even 90 year old people who have built their muscles. For example, Joseph Pilates, he was 83 and he was the most muscular man ever. So age is definitely not going to cause any kind of difficulties in strengthening. Rather, it will help you. Now, what I believe is, people below 40 years of age, whom you see in bulk working out in the gyms and in the fitness centers, but people who are above 40 years of age, women lose a lot of iron and calcium because of menopause. Men start building their stomach in this age, bloating their stomach in this age. So I'm really sorry for that. So these are the people who are 40 plus. In India, we see these people just walking around simply in the gardens, isn't it? So whom do you think the exercises are more important? We can manage. We still have a lot of muscles to hold ourselves and work throughout the day, but the muscles have started deteriorating in people above 40 and 50 years of age. These are the people who are supposed to do a good amount of exercise. Do not think that you are getting old and you are not supposed to exercise. Please, my dear, this is the age you are supposed to start exercising. Keep yourself strong and make sure the degenerations do not happen, or you can just cut down on the intensity of the degeneration of the spine. Definitely, it's not necessary. Aging is painful. Yeah, aging need not be painful. You can strengthen your muscles, you can strengthen your spine, stop that spondylitis, arthritis, and all that is causing pain, and you think it is because of aging. Not necessary. I have seen with young generations that they think that just doing cardio, just running on the treadmill, or just doing the cross trainers will be helping them. No, it is definitely not helping you. It will definitely help your heart, yeah, because they all come under cardio exercises, but when it comes to the joints, the muscles, the small or the big joints that are loading in such positions, they will start giving you injuries because you are not strengthening the muscles. For example, person who's like whole week he just sits and works at the desk, and suddenly one fine day, that is end of the week, I call them weekend warriors. So on the weekends they go and play some badminton or do the jump ropes. There is a difference between activity and exercise, right? Now, when you play, when you run, when you are doing any kind of cardio, when you are swimming, whether it is walking, whether it is running, my dear, these are not considered exercises. They come under activities. Okay, without strengthening or exercising your muscles, if you constantly keep doing activities over a period of time, they will start giving you pains. So better work out your hip muscles, work out, just tie some weights in your ankle and do some knee exercises, just some leg raise to the side, to the front, to the back. You can also use a TheraBand or any kind of elastic band to tie around the ankle and do some ankle exercises, keep them a little more stronger, and then do your cardio. You will definitely lose weight and without any injuries.